All right, so hello everybody. My name is Dr. Crystal Nagallo and I am Medical Director at Phoenix Anti-Aging Clinic. I have here with me Dr. Ashley Stein, who joined our practice a couple of months ago. And Ashley, thank you so much for Dr. Stein. Thank you so much for spending the time with me, as I know a lot of our patients want to learn more about injectable therapies for pain, specifically prolotherapy and PRP. So my first question for you is, what motivates you to treat pain?
Well, I think mostly because everyone pretty much has pain at some point in their life, I've noticed, regardless of age or anything like that. So I think it motivated me to start looking at other alternatives because, we kind of go through our lives knowing that there's pharmaceutical drugs and maybe surgery or physical therapy that might help our pain, but what about the alternatives? So up until I went to naturopathic medical school, I didn't really know about any alternatives. And after learning that there's so much more to do for pain than just those pharmaceuticals or surgery, it really motivated me to seek trainings in those modalities so I can help other people. So with naturopathic medical modalities for treating pain, you're kind of looking more at the root cause of what's causing the pain instead of just treating the pain itself. So I oftentimes look at a lot of blood markers for inflammation, things like that. The PRP and prolotherapy specifically are aimed at targeting the root cause of why you're having the pain in the joint or what have you. So I really like using those because, again, they address the root cause.
I love that. And I love that mainly because it really resonates with the core principle of naturopathic medicine. One of the few ways I would say that sets us apart from our osteopathic and allopathic counterparts. And I'll get this question a lot from patients, which is, my doctor had recommended that I do surgery. That scares me a lot. What are some of the other things that I can do? So you mentioned a couple of therapies already, including prolotherapy and PRP. I'd like to, if you could elaborate a bit on that, just because, other than those words being a little hard to say, I'm sure our patients are wondering what exactly that entails.
Yeah, so prolotherapy stands basically for proliferative therapy. And what that means is cell proliferation, so cells dividing and regrowing in the area. Prolotherapy is simply a sugar solution. So when you inject it into the body, the sugar kind of causes some inflammation in the area to stimulate the immune system to heal the tissues. So you can use it mostly in, I would say the most common use for prolotherapy is for ligament laxity. If you're having any kind of swelling or pain in the area from a loose ligament that's not strong from whatever, like a chronic injury, then I use mostly prolotherapy there. PRP is also kind of a proliferative therapy as well, although it just stands for platelet-rich plasma. Platelet-rich plasma comes from your blood. So we actually take your blood and we spin it in the centrifuge, and we take a layer in that tube that contains the most growth factors from your blood. We then put it back into the body, the areas that need the healing. So either the knee or the wrist or the elbow or the shoulder, to kind of help stimulate regrowth of tissues that might be damaged or inflamed. So that's kind of the difference between the two.
Excellent. Thank you for helping us understand some of the main differences. Now, is there certain scenarios where you would use one over the other or try one first before the other?
Yeah, so it depends upon the disease process, how long you've had the injury or the pain. But sometimes doctors use one or both in a certain amount of treatments. So usually I think the standard is kind of start with prolotherapy just because it's a little more cost effective. And what I use prolotherapy mainly for is to, like I said, help strengthen loose ligaments. So if that's the problem that you're having, that's what I'll start with. I can also put it in the joint space to kind of help with inflammation overall. And then with PRP, I'd probably use that more towards a chronically injured tendon or ligament that's kind of being torn a lot, like it re-injured a lot, because the growth factors are going to help stimulate to regrow the tissue. So again, you can use one or both even in the same visit. So it just depends on how many you've had before, how advanced your disease process is. And so your physician will be able to decide what's going to be best for you.
Super. And I'm going to follow up with some questions that I know our patients may have, which is obviously we're doing this to treat pain. Can they expect to be in a considerable amount of pain shortly after procedure, or not so much?
Yeah, so they can expect some discomfort. I mean, it is an injection, some discomfort, and some soreness.
Okay.
However, during the procedure itself, I get you on do a sterile field and put in some numbing agent. So while you're injecting, you will feel a little bit, but usually in the hour or two after, you're actually pretty numb, which helps with the pain. But the whole point is to stimulate some inflammation. So you're going to be a little bit sore, typically 3 to 5 days after, which is good because we want the immune system to be working in the area. So I usually tell my patients they'll be sore for maybe 3 to 5 days, and to avoid like vigorous exercise, but we do encourage movement. So immediately after, you can go ahead and go about your day, and that's what my patients love about this therapy, is because there's not really any downtime like surgery.
Oh, that's really good to know.
Yeah.
How soon can patients expect pain relief? And I know this will vary patient to patient, but generally, what would you say?
It really does vary. I can't actually, I would give you a range, but, typically people experience some changes within 6 weeks. A week after, you'll probably start noticing the pain will hopefully go down, right? The soreness will go away, and you might experience a little bit more strength in the area. And then up to 6 weeks is the healing process, right? That's when it's complete. So you can expect hopefully some improvement up until week 6. And at that point, we reevaluate to see if you need another injection, or if your symptoms are, good to go and you only needed the one. So it really does vary. Some people might need more than one injection.
Understood. And of course, this is something that you would work alongside our patients with if they decide to pursue this route.
Mm-hmm.
Excellent. Well, those were all my questions. Thank you so much for being here. I enjoyed learning. I always love learning, and so thank you for sharing with us your expertise. The best way to schedule with you is to call our clinic. And are you still offering free 15-minute consultations?
Yeah, if you have any questions, I do a free 15-minute consult. So
super.
Feel free. Yeah.
Great. Well, there you have it. Thanks for watching, and see you soon.
Thanks.
All right.